Hello, everyone. This is Anna Maria. I'm the Vice President of Marketing at Cincy. Welcome to today's webinar titled Using Technology to Optimize Care Delivery, the Role of a Virtual Care Communication Platform at Trilogy Home Healthcare. All attendees are muted during today's presentation. If you do have any questions at any point, please feel free to type your question into the chat window on your control panel. And at the conclusion of today's webinar, we'll review the questions and answer them accordingly or follow up with you respectively. Today's presentation is being recorded, and a link to the recorded webinar will be sent to all attendees this week. Today we welcome Jamie Seneca. Jamie is the Director of Community and Public Relations at Trilogy Home Healthcare. She will share her experiences and insights on this topic. She is responsible for developing, implementing, and monitoring a proactive communication strategy and tactical plan which supports the marketing and sales department's overall goals. She plans, implements, and executes Trilogy's strategic initiatives with the purpose of providing a platform for branding which enhances visibility in the community and attracts referral sources and new patients. Jamie has 21 years in healthcare marketing, and she has a refreshing approach when it comes to long-term relationship building within the healthcare industry. Our agenda today will cover the following topics: the role of virtual care in home health, why it's important, especially to keep patients at home, on track, and engaged in their care. Jamie will cover Trilogy's objectives for implementing a virtual care communication platform. I'll speak about patient interest in virtual care, and Jamie will share success stories, lessons learned, testimonials, as well as future use cases and the plan going forward at Trilogy Home Healthcare. Many healthcare organizations refer to the at-home, at-risk patients as the sickest of the sick. Unfortunately, these patients typically receive inadequate care and attention after being discharged. They often rely on emergency medical services and/or the emergency room to answer questions and provide care in non-emergency situations. The model for treating these patients and attempting to keep them at home and not back in the hospital or another care facility has not changed substantially in decades. In an attempt to minimize readmissions, case managers and/or nurses may physically visit these patients at home in an effort to help the patients stay on track with their adherence. However, this continuum of care model is not sustainable. The budget and resourcing implications are significant when most of the staff time is spent behind the wheel versus in front of the patient. Significant opportunities exist for virtual care solutions to bring the care closer to the patient at a more convenient and cost-effective manner for home health organizations, post-acute care organizations, the broader healthcare ecosystem, and the patient and family members themselves. Home health agencies are recognizing the value of implementing a virtual care communication platform to better target this patient population. Using a combination of a video-based platform and tablets, as well as smartphones, we've seen a significant impact on the cost-effectiveness, timing, and quality of care. In this session, Trilogy will describe the experience of using a virtual care platform. We'll also share some key metrics. Jamie will highlight results and overall outcomes so others can learn how they can evolve their continuum of care and communication models in terms of managing and engaging patient populations. Using the platform, providers of all levels are able to quickly connect, communicate, and collaborate with each other to ensure patients are actively monitored and motivated in their care from the comfort of their home. Patients, on the flip side, are empowered to actively participate in their care. They now have the ability to simply connect at any time with a member of their care team. And their care team can include a clinician, the visiting nurse, the home health team member, a pharmacist, and even an interpreter, depending on the patient's needs. With this, I'm going to turn it over to Jamie to speak more about Trilogy and their experiences in launching a virtual care communication platform.
Thank you for having me. Established in 2016 by industry experts with over 30 years in home health care operations, by experienced leaders who pride themselves in understanding the importance of the relationship between clinician, patient, and physician, now spanning in 38 counties with offices in Jacksonville, Port St. Lucie, West Palm Beach, Coral Springs, Estero, Sarasota, Tampa, Clearwater, Orlando, and Ocala. We strive to provide the most optimal care patients in a fun, forward-thinking environment. Trilogy offers a mix of services, including speech, skilled nursing therapy, physical therapy, occupational therapy, speech therapy, social services, home health aides, complemented by cutting-edge care and education to our licensed clinicians. Some of our specialty services include emotional and behavioral health with psych nursing. We are currently the only agency in the country offering in-home biofeedback for bladder incontinence and pelvic pain. We offer chemotherapy, IV hydration, IV antibiotic therapy, and respiratory therapy. So I was tasked with researching virtual care platforms to see if this was space we wanted to get into. Why Cincy? Trilogy selected Cincy's virtual care platform for not only its comprehensive video, email, and text platform, but also for its ability to service a diverse patient population whose primary language is something other than English. With access to over 220 live medically certified interpreters, we knew this alone would help our patients better understand discharge instructions and treatment plans, giving us better patient outcomes. How does Cincy benefit Trilogy? Well, it allows Trilogy to interface with healthcare providers and family members in order to ensure continuity of care. It also allows Trilogy to schedule workflows based on disease processes or discharge orders so that the patient remains compliant and engaged in their care. We all know engagement is a trigger word for the Affordable Care Act, ACOs, Chronic Care Act. Engagement is the word that we continue to hear. As Dale Click, our executive chairman of Trilogy and CEO, says, we are dedicated to delivering compassionate care to our patients, and we are interested in introducing technology to get desired patient outcomes and reduce hospital readmissions. With Cincy's platform, our clinical staff can better connect with our clients, giving us more touch points with them while improving patient engagement. Training Trilogy staff. When training Trilogy staff, I was sensitive to using the word technology. Clinical staff can be sensitive to the word technology because it can be associated with EMR or EHR systems, which can have a huge learning curve. I wanted to avoid any emotional barriers to accepting Cincy, so I rolled it out as a communication platform because essentially, for Trilogy's purpose, that's what it is. It is a communication platform that engages the patient, helps the patient feel less isolated, brings in remote family members into the virtual visit. We highlighted the intuitive user experience. We conducted role-playing exercises with all of our staff. We started in one location, Jacksonville, and used it as a pilot before expanding in other areas throughout Florida. Then we received feedback and responded quickly. It was a learn as we go, adapt where appropriate, and change as needed. So the virtual care implementation at Trilogy. We addressed Trilogy's top diagnosis codes for hospital readmissions, which weren't much different than the national top diagnosis codes for hospital readmissions. We used Cincy's platform to engage these patients to make appropriate action. We started with simple fun facts. Fun facts such as, did you know 1 out of 2 medications for chronic care diseases were not taken as prescribed? We felt that using these fun facts would engage the patient, alert them, and make them aware of some of the raw statistical data. Then we focused on initial initially on specific patient populations. The most obvious were owners of smart devices, more specifically, those that were comfortable with technology. We initially started with chronic conditions, including CHF, COPD, and diabetes. We then decided to move away from those, well, not move away, but to expand from those specific populations and go broader and not isolate any patient, but move it from any patient who seemed interested in their own disease process and learning more about it, or who had family members who wanted to be engaged in their loved one's care. So we expanded upon those three initial diagnoses. Then we structured care programs across conditions. So we have currently one office. We have a post-hospital discharge program in one of our branches for a specific hospital system. This program focuses on educating patients on preventing readmissions. So it's strictly an education program. Once again, we use some statistical data. We have some fun features that give some fun facts, but then we have some 90-second animation clips that they get every few days that just makes them aware of risks for readmissions. So it's trying to get them involved in their own care and making them aware of some of that raw data. We are currently building another program for a orthopedic group for a bundle payment joint replacement program. This program, this specific orthopedic office only wants us to have one nursing visit and no more than 4 to 5 PT visits in a 2-week post-operative cycle. So what we're committing to do is offer a nursing visit, a virtual nursing visit, to supplement that one visit. So it's not going to cost Medicare any money. It's something that we're going to do to supplement to show better outcomes. And we are working on a link for exercise programs until they can roll into an outpatient program. This is all going to be based on an outcome base and a commitment on our part. So there'll be a hyper exercise link for them. So we are able to structure programs that is based on a hospital or a physician or a practice's protocol in order to be able to get better outcomes. Then we are able to leverage multiple channels, which are the email, the secure messaging system, text, virtual visits, and then be able to monitor those to see what our patients best responds to in those programs. So basically and essentially, we are building programs to establish better patient outcomes and to fit the modality that our patients respond to the best.
The good news is that virtual care is of great interest and is truly top of mind for patients. With advanced technology in place and evolving, patients are interested in receiving instructions and care, truly face-to-face care via video in the comfort of their own home. The advisory board conducted a virtual visit consumer choice survey asking nearly 5,000 consumers across the United States about their interest in virtual care technology. They found that most consumers are willing to have video visits for select specialty care services. Speaking about the support that Trilogy provides in these examples, this slide really highlights the specialty care services that consumers prefer to access virtually and their top concerns. As you can see, consumers are very interested in virtual care. A few situations have been highlighted, and these are specific to address and critical to address in order to aid in the reduction of readmissions. Here are some examples of how engagement programs actually can be designed. Depending on the condition, depending on the protocol, going forward, patients can be grouped. They can essentially be put into a specific communication program with various types of touch points. As you can see, it's not a one-size-fits-all. And the timing is everything. So it's not letting the patients kind of go at it alone without sufficient communication from the home health organization. Instead, this is really scheduled to ensure patients are actively managed they're continually monitored, and they remain motivated in their care. And as you can see, there's various modality that can be used. So in-person visits still may occur, and SMS, text, video, etc. can be used throughout the actual care continuum as a home health agency such as Trilogy continues to provide compassionate and critical care. In terms of engaging patients, we could look specifically within conditions, especially for chronic care conditions, and highlight those patients which are more at risk versus others than being readmitted or returning to the emergency department for especially non-life-threatening, non-critical, urgent questions, which can actually be addressed via video. A specific program can be designated that really condenses the communication or even spreads out the communication based on the risk. So you could see a patient who is at a high risk, that the goal is to keep them at home, safe, healthy as possible, especially within the 30 days after first being discharged. They might have more of the visits happening, where the check-ins are either in person or via video, to make sure that someone is truly laying eyes, laying hands, laying ears on the patient to understand that they are on track, they're doing exactly what's expected in terms of their role in self-caring above and beyond what medical providers can do for them. As you can see at the bottom of the slide, a flu reminder can always be pushed out, or something else. Maybe if it's even a holiday message or a birthday message or whatnot, it can be pushed out to patients across an agency's census to really just make sure that everyone is aware of these proactive initiatives that they should also be taking in addition to responding to secure messages, text messages, emails, and of course the request for virtual visits as well as in-person appointments. The benefits to key stakeholders are many. So as you can see, it really goes first and foremost, no transportation required. So this is from both the home health agency as well as the patients and family members. There's no need to secure reliable and or affordable transportation for many of the follow-up appointments because they can be now done virtually. This also takes into account patient preference and modality. So some patients may feel more comfortable in receiving ongoing messaging and requests and reminders, whether it's for medication, diet and exercise changes, lifestyle suggestions. They might prefer to receive them in email versus text. So patient preference is really continuing to infuse what happens from the design of the touch points and the communication strategies going forward. What's great about a video platform is that it really allows the home health agency, their team members, to continue to keep eyes on the patient plus the home. And why do I say plus the home? Well, you could imagine, right, having a conversation with your patients, and if it's just done over the phone, you're not necessarily truly seeing what's happening in the patient's home without making an in-person appointment. But with the nature of video, you can really get a feel for the environment which the patient is residing in. If the patient has questions regarding his or her medication, and you know that medication reconciliation needs to be addressed, you could actually ask the patient to walk around the house and show you where the different medicine bottles, prescription vials, etc., are housed. And that really kind of captures the dynamic nature of this relationship. And it really builds the trust, too, because home health team members and healthcare organizations in general, we're truly guests in people's homes and in their lives. And we play an important role in helping them lead the best and healthiest lives possible. And with the nature of video, it's truly the next best thing to being there. In many ways, it's actually better than being there because it's more convenient for all. Another benefit includes care team collaboration. So if the patient has a question and it's truly about oh wow, not sure this is the right medicine to take, or there's an emerging issue or condition that a home health team member cannot address right then and there, the home health team member has the ability with the virtual care communication platform to truly integrate other specialists, clinicians, even a pharmacist, as well as remote family team members into the call. Therefore, everyone's on the same page, communicating with each other, more importantly, communicating with the patient, and everyone's aligned on the next steps going forward. So this truly reutilizes, optimizes the available resources that any home health agency has, and what, of course, it ultimately drives to is better outcomes for the patient and better financial outcomes for the home health agency as well.
So we have a use case of a male patient who had limited mobility due to breathing difficulty, high blood pressure for the past 5 years, 3 emergency room visits in the past 5 months, and was recently diagnosed with COPD. A typical action would be beyond our nursing staff and therapy to go out to send a respiratory therapist out who would drive to the patient's house for education, new equipment, instruction. The agency would incur costs and liabilities associated with drive time and in-person visit. As we know, respiratory therapy is a non-reimbursable service that we offer. Medicare does not pay for that, so it's an add-on service that we do for customer service and to do our part for hospital readmission. The virtual visit results in emerging situation easily determined during virtual visit, 2-hour time savings for each virtual visit, and possibly an ER visit averted. The benefit, productivity gains, respiratory therapists can care for 4 more patients virtually in the 2-hour time savings. Cost-effective care delivery, healthcare system saves $1,917, cost of average ER visit per healthcare cost intuitive report. The AQHR estimates the average cost of readmission for a patient is $13,800. Agency realizes savings from reduced windshield time. Patient satisfaction feedback was positive due to convenient, quick delivery of care and overall favorable to future use of technology. And actually, this patient we did get a card from, and when we have patient testimonials, I will point out this patient testimonial. When speaking to the nurse on this patient, this was also one that he did not like a lot of activity in his personal space. So being able to avert at least one of the clinicians from going into his home, he was thankful for. He preferred the virtual format over having people in his home just because he was one that liked his personal space. So we did get a card thanking us for that, and I will share that later. Another success story, it was a little bit different. This involved a family caregiver. So it's a patient's remote family member. Patient has had health decline and is moving from her independent home into an assisted living community. Her daughter is very active in her care, but lives remotely. Daughter has concern and guilt for not being able to be part of mom's care. So the daughter travels from New Hampshire to be able to be part of mom's transitional care. So the mom's moving from her home into an assisted living community, which already is associated with a lot of guilt from the decision maker who's the child in this case. There are communication discrepancies between the mom and daughter in regard to what took place during the home care visit. So either the mom, the nurse, or somebody wasn't communicating clearly, so there was a lot of mixed messaging, causing some confusion and a little bit of animosity. The virtual visit results, family became more involved in patient care. The medical power of attorney role facilitated by virtual visit. The daughter feels more engaged with mother's care. Obviously, there's better communication because the daughter was part of that virtual visit. The benefits, transportation savings. Remote family member can avoid travel expenses such as loss of wages, flights, car rental, hotel, etc. Quicker care decisions. Remote family member can be more aware of the care continuum, improve next step in the transition of care on a more timely basis. And then obviously patient satisfaction. Patient feels less isolated and feels more engaged in her care and likes the idea that her daughter is part of her care. So lessons learned. We started this process at the beginning, January of last year, of our research. I think we did our initial soft rollout probably around the end of last March. I think we went into this looking at how to stay competitive in the market, in the world of ACOs, and trying to do our part in showing positive outcomes and results and preventing hospital readmissions. And we knew that anything that we did to add virtual care would have to show some kind of decline in hospital readmissions. What we were the most surprised, the byproduct of Cincy, was patient satisfaction. So we didn't go into this for patient satisfaction, and we found that probably the most surprising benefit was that we are seeing that patients are more satisfied with the virtual platform, but the feelings of depression have decreased and the feeling of isolation have minimized. And while that seems obvious, we didn't go into that thinking that being a result. And so we are super happy with that being a byproduct of the Cincy platform. I've learned that a soft rollout to branch offices don't work. So as I stated earlier, Jacksonville was my pilot market, and I will assume 100% responsibility for this. I was super sensitive to not wanting to kind of push this down our branch's throat, because technology was in this format was relatively new or completely new for our company. And so I did not push it. I did not introduce it to our salespeople because I did not want them going out and selling it until our clinical team and office team was comfortable with it. So I did a very soft rollout and introduced it in little bits and pieces. And I learned very quickly that does not work. So when rolling this out, my recommendation is to roll it out to everybody at one time and get everybody's buy-in. And piecemealing it just was not a productive way of doing it. And that was a lesson learned on my part. Having a virtual care liaison in each office is essential for success. So this could be a clinical or non-clinical person, but somebody that has ownership of the Cincy program is key to the success. So they can see it through, they can have ownership and buy-in, and just an ambassador of the program. And then education to different departments should be limited to a need-to-know basis. Once again, I will take ownership of this. I was so excited about the many features of Cincy, and there are so many features of Cincy, that I was selling to my offices and my teams the features of Cincy instead of the value of Cincy. So when rolling this out, I think it's understanding each department's love language and teaching them the value based on what the value is to them, and not necessarily selling the features. And I think I got overly excited about all the features being on the marketing side of things. So it's just, I think, teaching the value and showcasing the value and what the value is to that individual department when rolling it out. So some of our patients, there are two of our patient testimonials mentioned before. The gentleman with COPD that had limited mobility, that was Louis Libby. We got a card from him, and one of the quotes was, "Thanks for the great and compassionate care that I received when I was with Trilogy. Your nurses and appointment and medication reminders through text were key in my recovery." Another one was, "Just knowing that in one call I can have a nurse there to answer my questions or look at my wound by video gave me peace of mind." And some staff testimonial. Cincy has been a great tool in keeping us in the forefront of a very competitive market. That was our general manager of our Estero market. "I can't help but wonder if being progressive with technology and virtual care helped position us to become a preferred provider with a very large account." That was a hospital system. We were one of 3 providers chosen. And while you never know why you're chosen, that was probably our biggest differentiator, was the Cincy platform. It has been nice to be able to provide solutions to hospital case managers who have complex patients. This was one of our home care reps, and she has a hospital that has a lot of non-English speaking patients, and so discharging for her social workers can be very cumbersome sometimes. So she's had a huge influx in some of her non-compliant, non-English speaking patients, and we use Cinzy for that whole patient load. So we're looking at our future expansion. I've probably spent our last 6 months as a huge learning curve on my part. And we are Trilogy is going to be very instrumental in an upcoming patient discharge program that we're doing. So post-discharge, in order to kind of somewhat micromanage patients after discharge to try to keep them out of the hospital. We are going to have a few touch points with them even after they discharge after us to do our share and trying to keep them out of the hospital. So better engagement after transition. As of January of 2019, we will roll out into 3 additional branch offices. By the end of Q1, every branch will have at least been exposed to Cinzy. So they'll have their initial introduction to Cinzy. And then by the end of Q2, we will be in 42 counties by then, and all 42 counties will be actively utilizing the Cinzy platform.
In terms of working with Trilogy and Jamie Seneca, specifically, it truly has been a pleasure. One of the things that Trilogy and Cinzy have been able to do is really help build that awareness, strengthen the reputation of Trilogy as a forward-thinking business partner with referral sources. So as you can see, it starts with the press release communicating that Trilogy has now opted to also include a patient communication engagement strategy via a virtual care communication platform, specifically Cinzy. And what was wonderful is that the media has truly been interested in this story in terms of seeing, how it's been using, what are the use cases, what's important for Trilogy, and how Trilogy is also using this within the broader healthcare ecosystem to, again, go back to their revenue streams, their referral sources, and most importantly, help the satisfaction, help the key scores, and help the outcomes for the patients themselves. Success can be measured in many ways. And as Jamie pointed out, one of the surprising things was the patient satisfaction that came through by implementing the Cinzy virtual care communication platform. When we look at measuring ROI in virtual care, a lot of times we call it a return on impact when you look at the investment being made. Virtual care can help home health agencies deliver important medical care where it's needed most, when it's needed most, and help remove barriers of time, distance, as well as provider scarcities. When investing in a communication platform, healthcare organizations, especially those focused on the post-acute care market, should consider an ROI, the return on impact, as well as the return on investment, that truly analyzes how virtual care is actually affecting the performance and the promise to date. Couple metrics to consider include time to consult fulfillment, so benchmarking the time duration between the request for a virtual consult, meaning that a nurse has wanted someone else, a clinician, to be part of a virtual visit, and what the response time is versus less dynamic, non-video platforms such as an in-person or telephone consult. Other success metrics may include patient adherence, so tracking patients' adherence to the treatment as well as their adherence and their compliance to the communication messages. So looking at which messages they're opening, which ones they're acting upon, how long it's taking them, if there's reminders that need to be sent out, and making sure that the program is optimized continually to make sure that patients really remain on track with the communications, but more importantly, their engagement with the home health staff. Readmission rates is something that's near and dear to all of our heads and hearts on this call. So measuring readmission rates and looking at who's staying on track with their care, and then who unfortunately is reaching out to the emergency medical services or the emergency room or urgent care clinics for questions which may have emerged that could have been addressed via email, short message, secure messaging, text, as well as the ongoing video-based virtual visits. Staff utilization, satisfaction rates are very important. Now you can really measure the redistribution of staff. As pointed out, staff doesn't need to drive to every single in-person appointment. Many in-person appointments can be augmented. Some of them can be replaced by these video-based virtual visits. And then looking at the patients themselves. So what is their loyalty? What is their own referrals to others, their family member satisfaction, neighbors, and others within the community who may have a need for home health care in the very near future? Few takeaways from today's webinar. First of all, virtual care programs can be used to improve patient engagement, managing patients in a way that lowers the risk of readmissions, especially with patients who truly are at a greater risk for readmission given the unfortunate nature of their condition or their chronic disease. Patient engagement programs should be designed with the patient's preference for modality in mind, as well as existing organization workflows. The goal is to truly make this another way of developing care that is something that's seamless for both the administrators of an agency, the home health team members, of course the patients and the family members themselves, and that it really reflects the patient's appetite for if they're using smartphones, if they're using tablets, they're using their PCs, as well as if they want to receive messaging via text, SMS, email, and their preference for virtual visits versus in-person appointments. And last, something that we didn't talk about and show, but what's important is, the reporting aspect of it, right? The data. So when I talked about really the utilization, it's making sure that staff is truly aware of how patients are interacting on their platforms and if they are truly responding to the emails and the text messaging and the SMS. What's wonderful about using a virtual care communication platform is that it truly drives value to the patient themselves, and it comes back to the team members, the core care team members who are working with them and making sure they're as engaged as possible in their care. Little highlight about Cinzy. So what we do in our virtual care communication platform is we address specific patient needs easily and seamlessly, both at a condition level as well as one's level of risk for readmission. Multiple touch points have been illustrated that are used to engage patients. Multiple modalities really bring the care to the patient in many different formats. And last, communications are as impactful as possible. As Jamie has pointed out, for those patients who are members of the limited English proficient population, messaging can be translated into the primary or preferred language of their choosing, as well as interpreters can also be used in these video calls to ensure understanding and engagement. The power of our platform really is at the heart of our solutions. It delivers a more reliable experience, really robust video. Again, the idea is to be as close as possible to an in-person visit. It's customized, so it's truly about how you work with your patients as well as how you work internally in terms of your workflows. And last, it allows for better access. So when a patient has a question, has a concern, has a need, intelligent call routing really is employed to make sure that patients are receiving the most appropriate person in the right framework of time to have those questions addressed, and there's no need to leave one's house and go back to an urgent care setting, a hospital, an emergency room department in that situation. So thank you, Jamie, for presenting on today's topic regarding the current and future environment for technology and optimizing the delivery of home health care. And thank you, everyone, for listening to today's webinar, which was hosted by Cinzy. Cincy is a technology company. We are dedicated to providing better ways to manage and engage colleagues, patients, and members simply and efficiently. We go beyond traditional telehealth with our award-winning virtual care communication platform for home health agencies and other post-acute care organizations. We have a few questions which have actually come up during the course of the webinar. These are questions that will actually reach out to the respondents, or not the respondents, but the participants directly with our answers in the coming days. We do appreciate everyone's time and interest. A link to the recorded webinar will be sent to all attendees in the near future and also posted on cincy.com. This concludes our presentation today. Have a wonderful day and enjoy the upcoming festive season.